and thank you for viewing my presentation. Today I'll be speaking about evidence-based strategies for developing a strong interagency response to sexual assault. My name is Megan Greeson, and I'm an Associate Professor of Psychology at DePaul University in the United States. I've been conducting research for the past 15 years on how criminal justice, medical, and social service agencies respond to sexual assault. In particular, I'm interested in interagency responses to sexual assault, which bring together these different groups to improve how they respond to sexual assault in their community as a team. I've examined these groups within the United States in my research. I've not yet conducted research in Queensland. So you'll need to think about how these ideas can or cannot be adapted for your local context and community. With that said, I do believe that a lot of the core principles of what makes collaboration work will still translate to your context. So I'll start by giving you an overview of my presentation. First, we'll talk about what I mean when I talk about an interagency response to sexual assault. Then I'll talk about the benefits and challenges of implementing an interagency response to a given community in order to improve the response to sexual assault. And then finally, we'll talk about how to promote an effective interagency approach to responding to sexual assault in a community. So we'll start with, what is an interagency response to sexual assault? Well, when we talk about interagency responses to sexual assault, we do tend to focus on medical, criminal justice, and social service agencies, the primary responders to sexual assault. However, in some communities, they might bring in other stakeholders as well, such as education folks. Regardless, these are very different groups when it comes to responding to sexual assault. They have different ways of approaching the work, different goals, different values, different requirements. They're very different, right? Historically, they've tended to work in isolation from one another, or in some instances, tensions may even exist between different groups. Then, when we talk about an interagency response to sexual assault, fundamentally, it's about having a concentrated effort to work together as one system. So rather than thinking, okay, the police are going to do their thing over here, medical are going to be over here, social services are over here, we're going to all work separately and leave one another alone. Instead, it's a recognition that the work is interconnected, so we should be thinking about our response as one big system, and that each part affects both victim outcomes and criminal justice outcomes. In order to accomplish this, fundamentally, these teams bring representatives from different agencies together to discuss their work and decide how to make improvements as a collective group. How can we, as one big system, make improvements to the response to sexual assault in our community? In some jurisdictions, this may even go so far as to having different groups, especially nurses, police, and sexual assault specialists, all respond to the victim at the same time, or they may even be able to co-locate their services in the same building. However, that's less common. In the US, our National Office on Violence Against Women, when talking about this team, says, collaboration occurs when multidisciplinary agencies commit to share resources, refer victims for services, coordinate or respond to sexual violence as a team, and monitor and evaluate interagency responses through quality assurance mechanisms. So some key ideas here are committing to working together, committing to considering the other groups when any one group responds, and then working together to reflect on and make improvements to their work. So you see those themes coming up throughout the presentation. So now that you have an idea of the basics of an interagency approach to responding to sexual assault, we'll talk about some of the benefits as well as the challenges. My research, as well as my practical experience with these teams, suggests that they have important benefits for responders, right? So one of them is that responders can learn from each other and therefore better support one another's work, right? So they can learn ideas about, here's what you do, here's what I do, how can we make those sync up better? As an example, I've seen police train sexual assault specialists on how to work together more effectively with police. I've also seen sexual assault specialists train police on how to more effectively build rapport and act in a trauma-informed manner with victims. So both are able to learn from one another, and in doing so, they can better help one another in their work too. In addition, this allows responders to respond more effectively to victims and cases. In this example, if the sexual assault specialist trains police on building rapport with victims, the police officer may be better able to support the victim and therefore gain better evidence and help them progress through the processes of the criminal justice system. In addition, when you have an interagency response to sexual assault in your community, responders tend to have better relationships. They tend to know people from the other disciplines. They have a go to person to call at any given agency, and they have better lines of communication. So they're actually able to talk to each other and they talk together more frequently. In addition, interagency responses have also helped specific agencies secure resources for responding to sexual assault. So I've seen teams fundraise together and write grants together to bring in new training for sexual assault medical forensic examiners. I've seen teams bring in grant money to help create a specialized unit within the local police department for dealing with sexual assault. So there's a lot of possibilities here, but the idea is that by working together, they can help each other. In addition, we also see that an interagency response can create a better response to both victims and cases. So we might find that victims might be more easily connected to services. It makes sense if the whole system is working together. The victim doesn't have to reach out to any one agency in isolation. Instead, by reaching out to one agency, they can get connected to all the others. Furthermore, an interagency response can help victims receive more comprehensive and trauma informed services. And ultimately, an interagency response may lead to better evidence collection and better criminal justice outcomes. These outcomes haven't been found in every community with an interagency response, but interagency responses can in fact lead to these outcomes. So in some ways, this approach makes a lot of sense, right? If we can all get together, we all affect victims, we all affect case outcomes. If we all work together, hopefully this should work out and make some improvements, right? Sure, but in reality, making it work is not always quick and easy for communities. There's a lot of challenges that happen. As you know, these different groups have very different values, roles, and goals when it comes to responding to sexual assault. Right, so that can have everyone not always on the same page. In addition, they tend to lack knowledge and trust of one another. Right, so you might always not. Often people don't know what the other groups are doing, or they might not trust them to do a great job. Furthermore, effective collaboration takes time and resources. Even if you have pretty good relationships already, you still need the time for the police to be taking time out of their police work to then go and collaborate with the sexual assault specialist. You need time for the sexual assault specialist to go and collaborate with the nurses and the police, right? So it takes some time and it takes some resources to do this well. So those are some of the key challenges. And you'll see that in the principles of developing an effective interagency response that we're trying to address those. So how can we promote an effective interagency response to sexual assault? This will be the bulk of the presentation. So I'll be talking about different principles as well as corresponding evidence-based strategies. So these are evidence-based from my research with interagency response teams in the United States. And I say evidence-based and not best practice for a reason. There's evidence that these principles and strategies can be quite helpful. At the same time, they're not a magic wand. So the teams I interviewed discussed how this stuff is complex and tricky. It's really difficult getting people in disciplines that are fundamentally very different to find common ground. It's tricky. And so these principles and evidence-based strategies aren't a guarantee of success, but instead think of these as tools in your toolbox. And then think about with a critical eye if you think they'd work in your area with the players that are involved in your community. So the first principle I'll talk about is the importance of relationships and buy-in. So an effective interagency response requires strong relationships and buy-in from all key disciplines. So an effective interagency response requires strong relationships and buy-in from all disciplines. So what do I mean by buy-in? Well, first of all disciplines must have bought into this idea of needing and wanting to do an interagency approach to responding to sexual assault. They have to be on board with a team-based, big system approach rather than operating in isolation from one another. This also means that they have to buy into the idea and have openness to working with other disciplines and being willing to change their practices accordingly. It doesn't mean that whatever one discipline wants you to do means you have to do. It doesn't mean sexual assault specialists telling police whatever they want and police having to do it and vice versa, right? It doesn't mean that other people are dictating your work. It does mean that as my discipline needs to be open to what the other disciplines are having to say, And then willing to think about how together we can all make adaptations to improve our work as an entire group. Finally, it also means agencies buying into their staff, spending time coordinating with other disciplines, right? So folks have to have the funding and the staff time to be able to spend getting to these different disciplines together, figuring out how they want to make improvements and executing those improvements. So some strategies that I've seen some teams use to increase this kind of buy-in. A really big one was what they called outreach. So just this notion of folks that were leading the charge, that were really interested in getting the interagency response team going, they would go out and they would meet one-on-one with other disciplines. They'd say, here's what we see as the benefits to doing in interagency response. How can we help you do your work even better? How can we maybe help each other and as a result benefit victims and the criminal justice system outcomes? So to have these one-on-one meetings over and over with different groups in the community, trying to get people to think about this team-based approach. Another strategy that folks used in getting buy-in was to look for champions who can bring others along with them. So by this, I mean, if I'm trying to get an interagency response team going, and I want to bring, say, the medical folks on board, I need to start meeting with medical folks and look for someone within the medical discipline that's going to be really excited about doing an interagency response with me. And that person can help convert other folks within the medical system to be excited about this approach and help get their buy-in as well. Similarly, those champions can help get leaders on board from each discipline, right? And they really talked about it was very important that during the buy-in phase that they would reach out and get buy-in from the leaders from each discipline so that they would be kind of on board with this idea of working together as a really big team. The reason was that ultimately these are the decision makers. They're also the ones that have to sign off and being willing to let their staff spend time doing this. So ultimately, without the leaders, they weren't going to be able to make the changes they really wanted to make. Finally, one of the things that finally, one of the things that interagency response teams really talked about was the importance of being persistent. At the end of the interviews, I asked, what else do you want me to know about interagency response teams that I can share with people? One of the interesting things we found was that people talked about the importance of persistence. They talked about how building relationships, building trust, building buy-in doesn't happen overnight. And some of them talked about, it can take a couple of years even to really get people on board, get people willing to start meeting, get people to feel like they're going to be able to be heard by the other disciplines, and that they really discuss the importance of being persistent and not just giving up. In addition, these really require strong relationships, right? So, not just buy-in, but strong relationships between all of the disciplines. So, to truly work together and collaborate in order to improve the response to sexual assault in their community, the disciplines need to be able to communicate openly and frequently. They need to be able to trust one another, that they're all going to trust each other to do a great job and trust each other to hear one another out. In addition, they need to be able to give and receive constructive feedback. Right? So that's asking quite a lot from disciplines that are fairly different from one another. So some strategies that interagency response teams in my research used, they really focused on getting to know people as individuals. I remember interviewing someone from one of these teams, and she talked about how when she started to get to know Bob, the police officer, as not just as a police officer, but as Bob, an entire person with a personality and a family and a life, not just as a police officer, it really transformed their relationship and their ability to hear one another out. So a lot of the teams talked about this and talked about the importance of getting to know people. So some of the strategies they used were informal relationship building. That could include things like sending notes and cards. So like sending a thank you card after a good meeting or sending a note during Nurses Appreciation Month to let the nurses know that you were thinking about them. This could also include attending one another's events. So, like having the police and the medical folks come when the sexual assault specialist had a fundraising event. This also included hosting potlucks before and after the meetings to help break the ice and get to know one another, open up that feeling of warmth and communication. And they also used get to know you activities or icebreakers. So, whether it was in the middle of a meeting or the end or the beginning, some kind of opportunity to just ask people questions like, what's your favorite movie? Or whatever it might be to start establish some meaningful relationships between one another. So in addition, they also use some formal relationship building strategies. So this included meetings, right? So meetings and talking to one another could start to build relationships. Also included trainings, so that could, or in conferences. So that might be going to trainings and conferences as a team together. It also meant training one another, and we'll talk about that in much more detail in the next section. But again, each of these strategies help them build relationships, start to develop comfort so that they can work toward talking to each other, figuring out how to help each other, and figuring out how to work together to improve the response as a united team. The second principle is the importance of learning about and respecting roles of every discipline involved in the interagency response team. This means that each discipline needs to learn about each other discipline's role and their limitations. So this includes things like what are their goals and values, what are they responsible for doing and not doing when responding to sexual assault, any policies that affect their work, confidentiality requirements. And it's important that in engaging in this process, that disciplines seek to understand one another from the other's perspective. So you want to teach me about your role, and I'm going to try and understand your role from your shoes. And we don't want to jump into asking each other to change before we start to understand where each group is coming from. So how did folks do that? The primary way that folks in my studies have done this is through what's known as multidisciplinary cross trainings. In multidisciplinary cross trainings, the team hosts a series of trainings which gives each discipline the opportunity to train all of the other disciplines about their work. This was universally one of the most popular strategies discussed in my studies. Folks always liked this, they never disliked it, right? So one participant in my research said, when we started doing cross training, we started understanding each other's roles a little bit more and realizing where people were coming from and why certain things are being done in a certain way. So why do cross trainings? Well, folks in my study talked about how those trainings can help people understand why others do what they do. Again, it helps people kind of walk around in the other's shoes, get an understanding for the fact that maybe some of the things that I don't like from my perspective are necessary, that you really have to do them from your perspective. So multidisciplinary cross trainings also help folks identify new ways of working together more effectively. I vividly remember the time that I was sitting in a training where the medical forensic lab folks, so these are the ones in the US that process the evidence that's collected by the nurses and doctors who are doing the exams, right? So the people that are actually processing the DNA evidence were presenting on what exactly they did with that evidence in their lab. And they had so many ideas for things that the medical forensic examiners could do and could do better, whether it was about documentation or storage, or simple things that would make their ability to process the evidence much better and hopefully increase their chances of having really strong usable evidence in the prosecution of the case. And it was stuff that had probably always been that way, but it was the first thing they bothered to get together and share that with one another. And the nurses and the doctors were going, this is great stuff. Of course, I'm happy to do this. So I thought that was really transformative and important. Multidisciplinary trainings also have other benefits, though, kind of psychological ones. So one is that it really helps people feel understood, right? So ultimately, as an interagency response team, we're going to get together, we're going to talk about what we need to do as a whole group to make improvements. And that's going to require a little bit of change from all of us, right? So by starting with multidisciplinary cross trainings, gives each discipline a chance to talk about what they want others to understand about them. And it helps people feel understood before asking people to make any changes or improvements. And finally, multidisciplinary cross trainings can help to start establishing role boundaries, right? So you can start to figure out what is your job as the medical forensic person, what is my job as the sexual assault specialist, what is my job as the police. How are those roles different? When does your role end and where does mine begin? If you can start to establish that, that can help prevent conflict. We'll also talk about protocols, which were another way of establishing role boundaries and preventing conflict over who does what later on in the presentation. But just know that multidisciplinary cross trainings, where you talk about your role with others, is the first step in establishing that. The third principle is that interagency response teams always need to commit to a victim-centered approach to responding to sexual assault. So when I talk about a victim-centered response to sexual assault, I mean that the team focuses on giving the victim informed choices and honoring and supporting those choices. This means that the entire team, all disciplines, utilize a trauma-informed approach to working with victims, right? So it's not just one group that's focusing on the trauma, but that every single discipline is focusing on how can we respond to this victim in a sensitive, trauma-informed manner? How can we all promote their ability to understand the choices that are available to them and then support whatever choice they decide? This is really important because research has consistently shown that this promotes victim well-being, right? It reduces their psychological distress, it improves their physical well-being as well. And it also impacts the quality of cases. When we found that victims are given informed choice and those choices are supported and they receive a trauma-informed approach from all disciplines, they feel better able to progress through the criminal justice system if they're willing to do so. And that can help improve the outcome of the cases. Right, so this is a fundamental assumption of interagency response teams' approaches. There's also lots of other resources that go in much more depth than this. These values make sense on the surface, but it's about kind of the details about how you implement them. And so there's lots of resources out there to learn about that more. A fourth principle is that interagency response teams need to secure resources and get organized if they're going to be effective. So that kind of makes sense. Again, we talked about collaboration requires some time and money. So I'm going to go ahead and jump right to strategies. Right. So we've had the great opportunity that funders in the US have started providing grant money for interagency coordination. Right. So they're actually giving out grants for the police and the sexual assault specialist and the medical forensic folks to get down and sit down and talk with one another. It's not just money for direct services, it's money for that interagency coordination. So what are folks using this funding for? Well, one of the major things is that it can help pay for a coordinator. So the coordinator can call meetings of the team, they can set agendas, they can take notes, they can check in on team members like, oh, we haven't heard from you, you weren't able to come to the last meeting, are you going to be able to come to the next meeting? Or looks like they can kind of check in if there was some conflict on how folks are doing. And finally, a coordinator can make sure tasks get completed. In the US, a lot of communities aren't even having this be a full-time position. It's often a part-time one. And it might be someone that works for one of the given agencies that's involved in the team, but a part of their role goes toward this coordinating group. And other communities in the US, they've gone for neutral coordinators that aren't part of any of the agencies in that community. They might do the work in a different community, or they might not be sexual assault responders at all, and they serve as the coordinator. A quick side note that keep in mind here that I'm saying coordinator. So think of them as the convener, not necessarily the leader, right? They bring people together, they keep people moving, they make sure the work is happening and they stay organized, but they're not making decisions on behalf of the team. Several of the interagency response teams I talked about they were able to really get their work together once they got a coordinator that started to take the lead and make some things happen. And many teams I talked to also talked about their team kind of fizzling out because they lost the coordinator position. So they really talked about these resources for a coordinator and this organization that the coordinator brings as really important for their interagency response work. Some other helpful strategies around organization includes having regular set meetings. So whether that's monthly meetings or quarterly meetings, but having regular meetings on people's schedules so that they know they've got to come helps people stay on the same page and helps keep the work moving forward. Some teams also use mission statements where they wrote down what they viewed as the mission of their interagency response to sexual assault in their community and use this later on to guide their decision making. Right? Some folks use meeting notes and agendas. And again, it was just about helping keeping them efficient and on track and organized. Many liked the use of subgroups to complete specific tasks. They recognize that if you have too many cooks in the pot, that certain tasks can be really hard to get done as a bigger team. So they would create multidisciplinary subgroups that still had different representatives from different agencies. They'd get those subgroups together to really hammer out some of the work, like establishing a protocol, for example. And that subgroup can get some work done efficiently and then bring it back to the full group for feedback. Finally, another helpful strategy that's recommended in the literature and the research is establishing ground rules, right? So establishing some ground rules for as an interagency group, how are we going to communicate with one another? And how do we agree to communicate with one another respectfully, especially around decision making and disagreement? So do we vote? Do we use a consensus model? Do we want everybody to be 70% on board with whatever decision we make? And as long as we can reach that, we're willing to go forward. How are we going to handle it when we disagree with one another? Right? So establishing some ground rules for how to make the meetings go efficiently and also avoid hurt feelings while still getting through the difficult work can help avoid some exacerbated conflict. Finally, the fifth principle I want to talk about is the importance of reflection and improvement. This is fundamentally what an interagency response to sexual assault is about. It's about reflecting on, as one big system, as one big group, how are we doing in responding to sexual assault in our community right now? And what do we need to do to make that better moving forward, again, as a group? Um, it makes sense, but it turns out I've saved the toughest one for last. This is definitely the hardest principle for these teams to adopt. The idea is that teams need to look at what they are doing, what is working well as what needs to improve. Again, it's a collective interagency group. Some areas for improvement will be easy to see and easy to fix, right? I talked about how the folks doing the medical forensic exams heard about things that they could be improving about their documentation that would make for better processing of evidence for the criminal justice system, and they were immediately happy to do it. It was an easy one, and that was great. However, at other times, people aren't always going to agree on what needs to improve. Again, we've talked about these are different groups with different goals, different approaches, different requirements in responding to sexual assault. So, what I think might need to improve as a police officer might not match what a nurse or a medical forensic examiner thinks needs to improve, and that might not match what a sexual assault specialist thinks might need to improve, right? So, that's where the difficulty of these teams comes in. So ultimately, the goal is to arrive at a shared understanding of what best practice looks like for all disciplines, make a plan and implement it, and then make sure it's working, right? So, what is best practice for everyone? How do we reach that best practice? Let's implement those strategies and then check in to make sure that our areas of improvement have actually worked. So, is it things like maybe sexual assault specialists need more training on working with police? Do police need more training on trauma-informed interviewing practices? Does the hospital need more resources for forensic evidence collection? What do we need to happen so that each discipline is implementing our shared understanding of best practices? And let's make that plan happen. And then once we've executed the plan, let's make sure it's had the effect that we thought it would. Like I said, the first bit is thinking about the shared understanding of best practice. As a group, we need to come up with a shared understanding of what each discipline should be doing. What is their best practice in responding to sexual assault in your local community? That means taking into account what makes sense locally for your jurisdiction. What makes sense in a very rural area isn't necessarily going to be the best practice or feasible in a very urban area, and vice versa. So thinking about coming up with what are our best practices locally. In addition, I'm talking about a shared understanding, right? I just want to make it clear that I don't mean that everybody is going to be agreeing 100%. It's about where can we find common ground and have people, for the most part, on the same page, even if I don't see everything exactly the way as you see it and vice versa. Right? So trying to find areas of that common ground that we can decide our best practice and implement those. So when we're thinking about strategies for shared understanding, ultimately it comes down to lots and lots of discussion, right? And that discussion needs to be open and respectful, right? One of the pitfalls that can happen in interagency response teams is kind of acting like everything's fine and not having open discussion, right? We would talk about in the interviews, I'd have some teams that would talk to me about how everyone got along really well, but everyone was afraid to ever make suggestions for improvements. So they really never got anything done because they didn't want to hurt one another's feelings. But then again, they weren't very effective because they were never able to talk openly about some ideas they had for improvement. Another strategy for developing that shared understanding is to use some kind of standard or expert that can help you have benchmarks to talk about, right? So experts in best practices for responding to sexual assault, whether that's researchers or national experts, whoever, or some kind of standards of practice from your field. So, like in the US, we have standards of practice for how sexual assault specialists should act, and we have some standards of practice for from the International Association of Police Agencies, right? So, if you have those kind of resources, or even just some interagency teams in a nearby community, they can help you see, like, this is what we have said is how a police should be engaging with sexual assault victims. And these are our best practices for sexual assault specialists. And these are our best practices for medical. And that can give you a starting point to be working from that's based in some kind of evidence from research. From there, you can adapt it and tweak it, but you don't have to write it from the ground up. And then finally, once you've got some, you're developing some shared understanding, right? Then a common strategy was then to create a written protocol. And in that protocol, folks would establish exactly who should do what and how for every single discipline, right? So it's writing out what are the best practices for every discipline and how are we going to go about implementing those. What are the differences between the different roles of each of the folks in the team or each discipline, right? So it's really about saying this is what each group should be doing. This is how it's different from the others are doing. And these are our best practices that we want to hold ourselves to. Protocols in the research in the US, they were considered to be tricky, right? It can be difficult to get everyone to agree upon what is best practice when we're coming at it from these different levels of agreement. But these were the strategies that folks were able to use. And ultimately, they felt like having it then put in writing could help establish down the road, if issues do come up, what was supposed to happen and how could we do better next time. So after you've established your understanding of what is best practice for everyone, then you need to think about how you're going to implement changes so that everybody's actually doing that. In the US, we often talk about this as action planning. So setting up to get from A to B, what exactly needs to happen, when does it need to be happening, what are each of the steps in that process, and who's going to be responsible for each of those steps. So there's some resources out there if you're interested in this tool and want to learn more about it. So when we're thinking about what needs to happen to implement these changes, what needs to happen so that we can each actually be doing those local best practices, could be a variety of things, right? It might be training, right? That's one option. Maybe it's resources, right? Maybe one group needs more resources to be able to implement certain best practices. Maybe an agency needs to change their policies. Maybe one of the groups has some policies that are getting in the way of collaboration, and maybe they need to be able to adopt some of their policies so that they can better coordinate with the other groups. Maybe there's some other bigger systemic changes, right? So maybe you want to think about, is our jurisdiction ready? Do we think it's a good idea for all of our disciplines to go out and respond together at the very same time? So it can involve a lot of different strategies. There's not one recommendation. It's very context specific depending on what's happening and where you want to go to make improvements. But regardless, you want to have a thorough plan for making that happen. Then, once you've implemented your plan for making that happen, you want to make sure the plan is working, right? The idea is, how are we going to improve? Well, we enacted this new plan to ensure that we can implement these best practices. Are we really doing that? And are the best practices having the effect that we wanted them to? So in the US, with my research, the teams use different strategies for doing this to make sure it's working. Some of them held ongoing meetings to just troubleshoot and discuss new issues as they arose. So that could be things like, oh gosh, did you all notice that we've had a sudden drop in the number of victims that are reporting to police? What do we want to do about that as a team? So they'd have kind of this open venue where new issues could come up. They also use this as an opportunity, for example, to talk about changing policies. So maybe there was a new federal policy or new state level policy that affected how one group was supposed to do their work. And that would therefore affect how the other groups are going to be able to collaborate with them. So they'd use these meetings as an opportunity to reflect as a group and bring things to one another to make sure they were still able to do what they needed to do. In addition, they would use strategies like conducting evaluations to make sure they were implementing what they thought they were, right? So evaluations involve some kind of formal data collection. And they used a variety of different methods. There wasn't one standard one, depending on what they wanted to do. But some examples were surveying victims about their satisfaction. Were they satisfied with the services? Did they feel they had a trauma-informed response from every discipline? Things like that. Folks researched reporting rates and prosecution rates to see if those were improving. There's folks that examined the quality of evidence that was being collected from the medical forensic exams. So lots of different ways of doing it, but the idea was that they conducted formal data collection as a multidisciplinary group and then reviewed that data as a group to see if they were achieving what they thought they were. And then finally, in the a third strategy for making sure the response is working the way you want it to is known as case review. So this is often implemented in the U.S., right? And it's where, again, this interagency response team, representatives from each of the agencies would sit down and they would talk about individual sexual assault cases, right? And so they'd pick out, okay, here was the case involving Jane Doe. And they would unpack every single step of what happened from the time that Jane first sought services till the time that they were done with their case and their services, right? And they would discuss what each discipline did. And then at the end, they talk about what did we do well? What do we think went well in the situation? And then where do we think there were some bumps in the road? What can we learn from this to do better next time? Right? So focusing on both the good as well as some areas for improvement. And focusing on, in doing this, folks really recommended focusing on areas for improvement rather than blame and pointing fingers, right? So really trying to talk about this, gosh, and next time I think we could do this better rather than why did you do that? What's wrong with you? That would be less than effective. Right. So those were the three strategies folks really used to see have the improvements we've been making work? Are we really responding to victims and cases in the way that we intend to, in the way that matches our understanding of best practices in our community? So I want to end with a conclusion that kind of brings the presentation back together, right? So an effective interagency response occurs when disciplines have sufficient willingness and resources to commit to working together and adopt a victim-centered approach. Then together, they reflect on, improve, and monitor the response to sexual assault in their community. It takes time and interpersonal skills, but doing so can benefit responders, victims, and cases. So thank you so much for sitting through the presentation with me. Here's my acknowledgments for the images I've used in the presentation. And if you have any questions, you're more than welcome to contact me. I've displayed my contact information on the slide. Thank you.